And this is healthcare bill. I don't know what part it is anymore. We just kind of got lost in that. I know I've got two part 62s, which actually that's supposed to be 62 and 63. But, you know, sometimes I get a little confused. Oh, well. Anyway, we're going to continue our coverage of the healthcare bill. Now, what is the duties of these navigators? Okay. An entity that serves as a navigator under the grant of this subsection shall conduct public education activities to raise awareness of the availability of qualified health plans. That means, first of all, you have to train your employees so that they can properly dispense healthcare information. Now, if you're talking about a doctor or a pharmacist or even a guy that sells you home or car insurance, that's not a big deal. Even accountants could do this. But when you're talking about going to your local fishing shop, that's a little different. So, distribute fair and impartial information concerning enrollment in qualified health plans and the availability of premium tax credits under Section 36B of the Internal Revenue Code of 1986 and cost-sharing reductions under Section 1402. Like you know where 36B of the Internal Revenue Code of 1986 is. Well, in my next video, I'll show you where that is. And the cost-sharing reductions under Section 1402, like you know where that is. Well, that's in the the Affordable Care Act. That's in that. So we'll get into that later. All right? But what they're saying basically is that you're supposed to train your employees, depending on your business, on how to properly dispense medical information. Now, this would be okay if you're talking about some guy that sells home insurance, car insurance. You're talking about your doctor, your pharmacist, that kind of thing. But when you're talking about the fishing lure shop, really? Or how about your local farmer? You going to trust your local farmer to know all this information? Really? Okay. Oh, and make sure that the information is impartial. Huh. In other words, you can't say, I like this company over that company who's going to give you health insurance. You can't do that. Really? Okay. Facilitate enrollment in qualified health plans. That means that this person that you're consulting with is going to help you enroll in that health insurance. Think about that. Provide referrals to any applicable Office of Health Insurance Consumer Assistance or Health Insurance Ombudsman established under Section 2793 of the Public Health Service Act or any other appropriate state agency or agencies for any enrollee with a grievance, complaint, or question regarding their health plan coverage or determination under such plan or coverage, and provide information in a manner that is culturally and linguistically appropriate to the needs of the population being served by the exchange or exchanges. So now, not only do your employees have to know all this health insurance information, they also have to be able to speak a foreign language. And possibly more than one. Yeah. Okay. So, there you have it. There you are. Now you know more of the story. I will tell you more in a future video, so stay tuned.